ya kwa ba de ba stream house TV so enne so ya da fofra nyankopon aye enipa bebre na watwe we yanti asempampa o mo na so ba de adaroma woda so tiase na wo hwe me a ya aseda na ye de be ma nyankopon enne the topic e dey dwa de nya asem ketwa ye topic nem say breast cancer ya kan wa asem ha sa ya we e de ya we and me pese me no mienu nyina ye rewura mu ne dive into it ne hu adekrontia sa breast cancer e kum e masa emponya mankwa na breast cancer kum mo ye topic e dey dwa so no breast cancer awareness enti twen me ko ba bia o sina twen me na me ba me da me ho ba me ba enne guest a wo do ye wo hanya asem ketwa enne ye wo professionals ankasa e be introduce you mo e wo show you so enti me da me ho aba me ba me introduce me wonderful guest na fe ye de nsem no atu wani ni apapa mu ehu ne poma sibre me ba sisia
Papa, COVID-19 by so to na de wo makonse do aso wabusa wo ho de ntia ebi mu survive ye na bi mu nso awu ansem buta we ehu hia me pa me pese me nya anu yie wo sorry a wo ye exercise wa ye kese abroso de ba de kwa na wo tai bi na wo didi wie kra wo tan ebre ben ansa na wanum suo sansem busa we nyina ye nsem busa ehu hia ye pa obi nso wo health issues a hana denden a opa no yie enu nti na maame jo me se hia me e wo stream house TV so me menda we ene me menda bia ebra abonondu adokobo du baako that is 10 to 11 hia me na me ne animdifo doctor fo o makwadare e wo nimdie ho ewo apomuden ho ni pensen ye ma wo health issue bia wo bia ho anu yie duma de ye fe na health palace wa pomuden ho hia ye
mo akwa ba biem de ba stream house TV so de mesre wa na say subscribe to stream house TV afi wa subscribe ye wiem make sure so be like na wa share my because I want share program here program is very educative you make your friend health palace and I will share nti bomodin asa wo be share no bi so anya bia hwe because obi wo ha oni ma de krokro your friend breast cancer but na ye be ma wo hu ade kro me din a me pesa de bia wo de frame ya ma me jo aso pesa wo hu Facebook am jo so na boaje me no wo hwe me wo ha bia wo pesa wo hu about me bia wo be hu afi wo betimi akọ Facebook Stream House GH na wako like it your links ni na betimi a share afese wo ho as Stream House Studios and so betimi a share cause so na hwe program me nko ba bia nti na me guest a me be introduce o mo na enya agoro Dr. Sai Kuku Damo and na de enya agoro crowd and I have with me Dr. Fiba Fets yeah from Nust Hospital and I say and they had any tech hospital or your doctor or yes is why a young lady to or your doctor or your doctor teach pa you introduce him manifest because a man never what you mapan here you poor one sabe bibi bedamwa no one in ejayana so we can ejana it's happening to me sign so what Mrs. Catherine Ajubi our midwife at a new hospital ewo buedi ono so netwa ho fefo pa na me guest in Nyagro I have wonderful beautiful guests I will say I also have Dr. Edu Berima Joshua and I'm Mr. Edu Berima Joshua also a staff nurse ewo Nanshia Hospital nti na your guest I wo ha na Nyagro kra and that the kai doctor kra fa no ho your doctor is a good and power to Mr. Omenko Bebia just subscribe to Stream House TV na share program no because also our show program we yeah the education kesiye pa ene beba. And then we are talking about breast cancer awareness. Intimeko doctor Fibaho Nababusano about doctor. You are welcome to the program.
Thank you very much.
Yeah. And Mr. Joshua Akwaba. So where? Bom mame, so kasakese. Speak like a man. And I'm man and meow. Sir, advocate Akwaba. So where pa? Open here boat him and say. I don't know as a breast cancer awareness time we are more think.
Say money dominates disease in Muntia. So remember to me. I just say wait now.
A man and them some memories soon do cry. What causes this breast cancer that we are talking about?
Alright, so
please speak louder for me.
Okay.
Speak like you are talking to a client.
Alright,
you understand?
Sure.
Yeah.
Yes. Alright, so when it comes to the causes of breast cancer, there is no one particular cause. In fact, there are several risk factors that we look at. So I'm going to discuss a few of them and the most pertinent ones.
Okay.
So the first one is the sex. So females are more predisposed to having breast cancer than males. Males will account for only about 1% of all the breast cancer cases. So it's a disease that is more predominant with the female population. And the second risk factor will be the age. So the older you grow, you are at a higher risk as compared to a younger person.
Really?
Yes. So in fact, in the African population, our peak age incidence is between the age of 40 to 49 years old. So that is the age in which we see the most cases of breast cancer. And then some menopausal women, when they pass the age of 50, 60, thereabout, they are also at an increased risk of getting the disease. And then also we have the family and the genetic factor. So if you are in a family where you have a first degree relative, that means either your parent or your sibling or a child of yours was diagnosed of breast cancer, you are an increased risk of also getting the disease. In fact, it's recommended that if you have a family, a first degree relative who has suffered from the disease, you should start screening very early. Okay. So that you are aware and you can diagnose it on time and treat it on time. And then there is these genes that sometimes, for certain reasons, some people inherit it. It's called the BRCA1 and 2 genes. They are also it's called BRCA1 and 2.
Hey, Medofo.
So this one
so BRCA1
and 2.
And 2.
Yes, please.
It is
I'll try to keep it as simple as possible.
Okay.
So these are certain genes that certain people inherit, and when you have these genes, then you are also predisposed to getting the disease as opposed to someone who doesn't have those genes. Okay. And then there's also the component of lifestyle. So certain theories have been put forward that if you have a high body mass index, like if you are obese or if you eat fatty,
meaning I am at risk, right?
It is a theory that is out there, but as to the data to support it fully, it's not really like for sure. Or okay. Yeah, but then they say if you eat very fatty foods, alcohol, cigarette smoking, all these are factors that could influence or affect you and predispose you to getting the disease as well. And then there's what we call the hormonal status too, which is a risk factor. So estrogen here is a hormone that is called the culprit, I would say. So any woman who, or I would say any condition that exposes a female or even a male to high levels of estrogen, because this is the feminine hormone in the body that causes the breast cells to proliferate. So for instance, if you start menstruating early menarche, like the age at which you had your first menses, if it's very early, it also puts you at risk because it means over your lifetime period, you have many menstrual cycles. For instance, if you start menstruating at 11 years old, the age of menopause, there are about certain people 45, 46 something years where you are menstruating, as opposed to someone who maybe started menstruating at 16, 18. And then also,
so does it mean that someone who menstruates early, like a young lady who menstruates early, it's at risk of?
It's one of the risk factors.
Oh, okay.
You see, as I said in the beginning, there's no one cause for breast cancer. There are certain etiologies, there are certain risk factors that are put out there. So it's a combination of many of those that can now make a person have it. But I'm just naming a few. It could be this, it could be that. So it's not one particular thing. Some people start menstruating early, but they don't get the disease. Others too, when they start very early, they are also at risk, especially those with a family history. So these are things that vary. Also, one protective factor they say is when you are lactating, when you are breastfeeding. Because during the entire period in which you are breastfeeding...
We will come to that.
Okay.
We will come to that. Let me go to Auntie Kate. Auntie
Okay.
Kate, this breast cancer that we are talking about, does it spread quickly? Because sometimes people are say lamp naba crabby. Okay, wait. I want to know, like, how do you even determine that you have it?
Okay.
Best then I want to say, adewe menyebi, because me want to say Kate bomb said the way hallelujah was sorry.
Maybe I can say early detection. The one person will be to me who needs them. And my also who you need, especially a breast, na yaka one sense. In the same about the button, no say, and brand will be a better enough for say, a dear neck was on for you. Bet me, moo, ashe, and no phone it to me, what could do your motum, to put me, aqua, motum, I say, be them to say lamp will be
no. Me ma try me who said the messy iron tea. And no, if drew, I ben you be I am my member, so what dear bay, open you be am an I am actually been you be I am. So, send your midwife back will be so oh, boy, chido. I won't pass over Baha.
It's a let me do on why. It's any idea here, so baby, and
then Kayanya no,
be patromatic.
Yan said this. Because say lamp now can most people doesn't know what that lamp is. Okay. I, for instance, I don't know. Okay. Because all we know is breast, and the breast has a lot of yes. I don't know if it is fat, but they can't call it bajoa. I think that is the lamp, right? Right. Already know, you know, say growing from childhood, you have this lamp already. So, like, how would you know that there's a different lamp? You get it. What a my share and no person say a quite best on your best so you be yes okay
the kind over here say who means pretty that time no because me our menses say na enu mu yedu kakra nti ya obenya anka obeye na after our menses na ya hwe say ni fa no na me person hwehwe mu a ni nsa ni fa no betu matiko say na fe me nsa meka me nsa enso ano abo ho yen sans wani yam say na be miemia yen fan point so
order for me gidi ye sa wo hwe ye pa ye ba be ye bu demonstrate e kwan a oba anan po bema because enye man kwan na timinya breast cancer ana bema kwan obefa so a obetimi aye den a check say wo lamp ya ye kan bia already ye obadwa we no funum dada. But this time around we are talking about lump a betimi developing into breast cancer. Breast cancer no so eni je ba ko eni je sama ya wo mu so ne se eye wanya no se eye wa na wuwu e kwan wo ho a obefa so a obetimi because e won krofo bebra be pacho production ya moma ye nhwe omo a eni da so like ye twetwa omo de no but eni da so wo ho se saa de we e to no funum crampo na ubehu se aha e na ye hwe wo ho no there are some people like yakate they've removed. I don't know if it is the lamp that they remove or what, but still they have survived. Yes, so there is hope for anyone who has breast cancer. If you don't lose hope, if you are watching me and you have breast cancer, and all is not lost yet. So definitely, as we keep on with this program, I'm sure you get to know much about it. Yeah, these are some people they didn't die, and they are advocating for breast cancer, telling us that even though you have breast cancer, you can survive it. Auntie Kate, so asoma
if I show you. Into kind so better show me for him. I who say about you be edem. And then you know one
now watch baby.
Auntie Yentre send a bit yashuno. She said,
if I had any baban, can I do a bite with the
show you. It's in person me share me no food bunkunima. The Missa bunkun betu mechi. Then General Obit Madaho, bet Miss Regina Wash. Tinfancy said they met 20 Mijina, to say the Mijina. To best started free, but my started free, what to a mono. Be me, kakran kakra. Now they are back the fan phone in the secular form, as all call kakra one kakra wo miamia no de wadwene bi akire du baabi na se hwa ye den kakra no wa se ne den ne etese de na hye ho so be miamia na de afa ho kakra wo kosoro aba fom ni nyesi na wi na ba mfimfiri na no ho no baabi hwa etuntum on so be mia ahwa ahwe na wo ye ne se wi a be dia wo funi no aso ano tuntum no mia aba no ne ko no ahwe se nso be ne wom ne nso ne wom ma ne kala te se ete se moja sufi ana emoja ene so kan bibi kire ye nti be mia no fo ahwe to ye ne bonkum ni wie na pese ye ni fa na the same thing wo don sa ni fa be ko wachi se na bonkum ni na sese de ni wo di be mia nti be ka won sa enso ana bo ho nan no na de mfin
sa wo mfa one finger
okay empia so na sa wo be me se lamp in case bi wo ma to be ka bo na se pad na fe wo di mia afi wo moto anim kakra na de fa no fo no
anyways, Pacho, lest I forget, Pacho, let's take our breakfast on this show. Doctor, everybody, let's take our breakfast because when you come to this show, we have a breakfast that we take. Doctor, please take yours. I beg. Hey, Obi Nyabino. And I mentioned hospital for a anywhere rather anywhere for more share Petra Safu bio and I bet na I know say on casta now then a hot by en cash in channel tienem munua ha and a program no I say about say and when you know ready and so me Petra Safu bio ha our boy chidom if I thought to us my
that's showing that it said you're not making so we have bunku you now any fan befa ho ni na round na dia quest we na no adwin dia chese wo du ba bi na yedin na so wo de beba mfimfiri na no tuntum wi na so be mia tuntum na ba no ne po no ahwe se nso bi wo ma na wo wi na wo nwie be gina ahwehwe anim ahwe ono fo ni mienu ni shape te sese na esiti esisi wo no ensesan bi abemu ana afi ni kala no so kura no so enipa kokwa ahwe se ni kala na ba bi esisa no wa hwen so skin no so kra nsetan bi abemu ana because ebi wonu man nsetan
skin no so timi sesa
e ba chewan ebi wonu ho na yete se de e hwa ye red and aye kokko na ho na yete se e hwane enu se timi yesa na e hwa ne po na obi a ne po no normally ya na si no fo na no ya wonim dada se wo no fo de si ano ne po ne si ano but bon se we bedru me bi na yete se e inverted e pese twikom yes ne po na no e twiko e chire.
Oh, okay.
Na so ye science mu ma hu so se na esi kwa bia e cancer ni bia ana no fo no ho na afo be na ba bi e ka kom asa dempo be wo ho no aka kom kakra de se kwa obi usira hu se na fo akeka kom no obi hu se no fo no ba bi aka kom te ne sa no so ma hu se de bi ye kwe o se mko na mko hwe se breast cancer ni bia na nti we ni normal etimi da edi mi ye hu se na bi ye kwe breast cancer na e ha me
that's a pa nyame shira Uncle Joshua, me pacho, sa yare ya can wasem. Spread it quickly. Send it spread it far.
Okay, with the spread, it depends on said the SED epidemic match. Because cancer, the cancer be spread. Cancer be spread. Every cancer is able to metastasize to other parts.
If I say it was some now can you
cancer be to spread different parts of the body. And then particularly the breast cancer, it depends on the stage now. And I bet you say a best spread it and I say and spread it. Yes. Until with the spread need a spread it, but how quick it will be, it depends on the said the SCA do much.
Okay. See your stages.
Sure.
Cancer no I review. Yes, I was stages. Really?
Stages won't
Hey, and doctor. What are the stages? Because I understand there are stage 1, 2, 3, 4 or something.
Yeah.
Oh, okay.
So the staging system was done so that doctors internationally can agree on the management of every cancer case. So we have 5 stages. So we have stage 0, stage 1, stage 2, stage 3 and 4.
5.
And then there is what we call a scoring system that we use to arrive at these stages. It's called the TNM classification. Where
TNM?
Yes, please.
Okay.
Where T stands for tumor, size of the tumor, the primary tumor. N is for nodes, if there are any lymph nodes involvement, and M is for metastasis.
And they is dear, and then brought na nyagro, me doctor wa kono kra fan. And they is dear panty patch on a more serious note. Breast cancer ya there e kum nipa. E kum ma pa o awo. Na ayana ya so better say obi ewu out of breast cancer because Ghana ha ye ignorant bebre. E was higher real. Nti doctor church ye mu a ebema ya say yare na say to all churches to say at this point ye stages no the stages of cancer and what shall say our church so doctor continue for us.
So based on this TNM classification, if a patient comes and let's say you have T0 N1 M1 based on what you score with the TNM classification, then we now put you at a stage, either you're at stage 0 or stage 1 or stage 2 or stage 3 or stage 4. There are sub stages for these stages, so I wouldn't go into that because, for instance, stage 2, there's stage 2A and stage 2B. Stage 3,
we have
there's
to go there
A,
because we want to know the details.
Oh, okay.
Yeah.
All right. So normally, stage 1 is a non-invasive disease. It means that the cancer cells are found just within the ducts and the lobules of the breast.
Okay.
The surrounding breast tissue usually is not even affected. So that's usually stage 0, non-invasive. Stage 1, 2, and 3 are invasive breast disease, and then stage 4 is metastatic breast disease. Means it has spread to other organs like
that's
the brain.
Stage 4.
That's the stage 4. Yes. So coming back to the stage 1, when you are at stage 1, normally the tumor size, that's the primary tumor. If there is a lump you palpated, usually would say it's between 0 to about 2 cm, and then there may be some lymph node involvement. That means the axillary lymph nodes. With stage 2, sorry, you have a larger tumor size, where in this case they'll say maybe between 2 to 5 cm, and then more lymph node involvement. So for instance, stage 3A or 2A, I'm at 3, right?
Yeah, you are 3.
Yes. So 3A, you may have maybe 1 to 3 axillary lymph nodes. 3B, they'll say 4 to 9, and then 3C greater than 10. So it depends on what the patient presents with, and then we place you at a given stage based on the TNM classification. So what the public generally should know is that usually the higher your stage, the poorer the prognosis, means the outcome. Means someone presenting with stage 1 is at a likelihood of surviving better than someone who presents with stage 3, let's say stage 3C or even stage 4. It means you are presenting with a more advanced disease. And how quickly it would spread, as you were saying, it depends on a lot of factors. There's no one factor that we can say this is why a cancer will spread more quickly. Certain cancers are more aggressive than others. For instance, the inflammatory breast cancers are very aggressive. Those ones even present with an ulcer on the breast. So
Inflammatory
breast cancers, yes, usually they can be very aggressive and they spread quickly. So it depends. So if you have a family history, the age at which you were diagnosed with a breast cancer, all these things, if you are maybe resistant to treatment or not, all these things will play a role as to the doctor or the person, the team taking care of you to determine how quickly the disease will spread or how it can be curbed so that you do not die from it.
Okay, thank you very much. Mr. Joshua, Mami Musao, Saya cancer. What who said stage way and I'm a womb stage way because once I Ghana ha kasa party near daje. I dey ko say you check it. Even quite sometimes people will feel the lump but they will ignore it. Nti sa yare we na the better one who say stage way man amewura.
With stage ni the whole client no you didn't know the stage na we do no. Because no kra no. Na
emma wo symptoms be
they show. There are particular symptoms over exhibit as a patient, but if you can dream, as say cancer, some of them say like na sister kids can over puppet, who lamp no all right, but who are not dream as say because lamp no a put at risk of getting the breast cancer.
A man who carry Ghana for a hosem back when I say a hosem back why na man and say me no for my dress a menu. Ana me yare. So that we don't even think of that breast cancer.
Yeah. Well, I would like to add that not all lumps are even cancerous.
Sure.
Yeah. So the fact that you palpate a lump doesn't mean you have cancer. You have to go to the hospital so that you can be properly examined.
Meaning the advice to the public is look into the camera.
Yeah.
Tell
so the
them.
advice to the public is if you do a self-breast exam and you palpate a lump, kindly visit your nearest hospital where there is a breast care facility and be examined, because it could be cancerous or it could not. It could be a benign mass. That means it's not cancerous. So on your own, you wouldn't be able to tell unless you see a professional who would examine you and do other tests to arrive at a definitive
The
diagnosis.
examination is very important because they say early detection saves life.
That's
so you
true.
may have this cancer, you wouldn't know.
Yeah.
So please, Ghanaian ladies, Ghanaian ladies, or whoever is watching me, at least every month or 3 months, go to the hospital and check whether you have this kind of cancer or not. Because in fact, we really care about your health. And this cancer we are talking about is taking many lives. So please, oh Shemia, me say me power chow, me slow baby, and the doctor may kasa na frafra, no problem. Me na ye frafra wa say because ye beto aba, ye ke kambo, yeah ye. Ti me slow, but modia na ko check it, check it da, ko check it. Your cancers be real, but ade ba ko ye kumuni papa and Auntie Kate. I mean, without say your cancers na do so pa. By your word, ye kumuni pantentem. Last time I was checking that, I realized after breast cancer, another one I said a lung cancer. I know so it kills very quickly. It just a sanima way in ano. Does it contribute to what we eat?
As in,
Like all the cancers that we are encountering, is it because of the food we consume or?
as I said earlier, there's the component of lifestyle in it. They say the kind of food you eat. You see, as we have improved on our lifestyles and we are adopting the Western culture, our diets will have changed a great lot. So some people or some theorists will propose that the high fatty diet, a sedentary lifestyle, you don't exercise, you're obese, all of these things sometimes are like factors that could put you at risk. So yeah, it's very important that we watch out for what we eat. You should be active, exercise. I mean, they always advise that at least 3 times a week, if you can have some mild exercise for yourself, it's good for you.
Okay.
Yeah.
Thanks a lot. I am Uncle Joshua, and Miss Smith, Uncle. What's the more of a being for Uncle Joshua? Uncle Joshua, is there a treatment option for this killer disease?
Okay, there are 3 treatment options. Let me see.
It's a cancer, right? Yeah, it's a cancer. It's not just disease. It's a cancer because you communicate too much.
So there are treatment options.
Yeah.
Yes. We have the radiography or the radiation therapy. Yes, and we also have the chemotherapy, and then we also have we have hormonal therapy. That one too is also
Hormonal therapy.
Yes.
How?
Then surgery. With the hormonal therapy, that one, there are some of the clients when they have reduced estrogen, as doctor was already speaking about. They have limited, signs to show. One, the estrogen levels for my bones say now I said there is remesis. It is those people they either go to ephroctomy. That's a ye ovaries no. Yes, we undergo surgery ye ufons no. Now say the ovaries no. Therefore, then it means the ovaries that are producing the estrogen. Yes, so when that is off, it means the levels of estrogen also be reduced. Now, nipa also exhibition of breast cancer. So element. Yes, and then there are some people like after their menopause, and then they will be exhibiting these signs. So some of them they are giving some drugs, and there are things that doctors they have that right to prescribe the drugs. Yes, they have some drugs that they take in. Yes, that one too. They are all hormonal therapies that they do with the drugs aspect. Yes, so they give those drugs to, help to produce or less estrogen. Yes, that one is the doctors that they prescribe a drug. Yeah, they need that right, they prescribe the drugs.
So, doctor, do we have a vaccine for breast cancer?
No, please. There is no vaccine.
Really?
Yes, please.
Unless you go under therapy.
Yes, please.
And how sure are you that when somebody has this cancer and they go for therapy, they are going to survive?
That's the thing. So, depending on the type of cancer you have.
So, what are the chances? The chances of survival when the person gets to the stage 3?
Usually the chances of survival with the later stage is not the best. they would probably say most times like a 5 to 10 year survival when you're at a very late stage. But the good thing about it is that when you present early, like in stage 1, and the mass or the lump can be removed, you could actually be cured of breast cancer, because when the mass is taken out, usually you could have chemotherapy or radiotherapy added to it to kill the cancer cells. But then that doesn't mean that it cannot recur again. You see, cancer is a very tricky disease. Like, you can cure someone at an instant, and then maybe 4 years in the future they come again with a new occurrence.
Okay. Really?
Yes, it's possible.
Hey.
So it's just, I mean, if you've been diagnosed once of any form of cancer, you just have to always be on the lookout for it. Like, constant checkup, you're always alert. So in case there is another one that is starting again, you treat aggressively.
So after treatment, it can reoccur.
It can recur.
Hey, that's very serious. Oh.
You see, one thing is, even with the risk factors, there is a particular point that Dr. made us about. That if even a family member has ever been exposed to, you're also at risk of getting it. So if even yourself also have the cancer and then you've been treated before, you also still stand a chance of getting it again.
It can happen.
Moving short of words, Auntie Kate, let me ask you, what can our men do to support us? Because most women are dying out of this disease. So into your man, then I'm betting I the abua man. Because I never come in when it's as a man so come with you. Almost some man for mass or money bentoa. Our mumia. It is sad way. Then a man to support us.
Auntie told me that your man, you be here on power, Poya, best answer.
I like the word you use. It's a battle. We are battling with this disease seriously.
Yeah.
Nasaku, where you try, and no phone. You need the man cry, and you come to say, Mamma, Sabia no more. Yeah, you couldn't. It's your best say.
Sassay, Chichim, so when you come home, Sassay. Oh, I don't know me, I will beat me by fat and said, yes, World Cup, when ya match no. Yes, now I'll be me and no force said when ya bentoa. They press it like a syringe. That's how the men do it. Like, yes. So I'm asking, what would the men do to support us? Because most men doesn't even know how to hold a breast. So when they hold it, they press it like they've gotten a syringe. It's serious. I think it's so.
It doesn't make any say. And I'm so money. I'm running, no more buy enough on who debate ya grow sabi pemua. The best woman. Yes, I would be in quite a camera no catch room. O camera anyway. She will not catch room, mammy. Momonte no natural said yes, so I may need ya befi no more so most of no more years I may my. There's any I can say, go on one about you grab them. A born crown and nipple. I bet a queen inside. If I may or banner me. It's a water bahono. Banners say be a band, Tampana no draw my attention. Oh, really a ban, I'm my wife. And then make me look for my wisdom society be a abound and Tampa to one of hospital. Yeah, best saying so mono so Sabia one and I look for one to say near other parts when I'm emery. Into be some gently. We quite a tune and no man or rest when you're chewing gum. So gently. Nay, so I son of Sabit. Yet you try more real come because the man be more real or so a fool. It's meeting one. And no, say it do cervical cancer, because almost a fiend. Near one day, Yaman quan and what it was so much. You also more recent in San Nils and also our form come. None in San if you be a new home. Now, or the best in the room so on say, on car, no phone. Because the empress a crew, ever ban no phone. It's what did you when you dear baby? A man will be a cow. Oh, and yes, because tissues are very delicate. Into capene danicra, a cronia me and what man for fast and for France so they are bra. It's message say, did you any no? I see Uncle how they can't be biting it like they've gotten spring roll or any other stuff. Yes, okay. So, Mumbai is Aquanos, maybe see a diagnosis with wife, so you're really a bar. Me and Jane are Jane crime, you refuse me the better. Aye, me and Jane no a Jane cry. Because we need support. There we are bar. A dear Mr. Crabber told when you say breast cancer. Yes, no one do now send you ubu. But Tessa, Yadika doctor near your medical me, I say, early detection, so the band, someone. Put me surviving. nti memma ne mboa ye enya se ba na me beja awaware nti na obu akwa won kan because ni kunu tie onim se o be wu agya no ha na so obedwa ne kura agya no nti emma ye that support no na ba financial support no so mum brem because ebu a ne treatment no ebi e ka wo oba no nko antimi nti wo be ma no gina echi ya na aboa na me ne treatment ne bibia ye complete nti mum nja ya jeje mu se wo yire nya na wife na wunia bi enya breast cancer nti wo ja no hwa de bi support no se na be ya na bi ani je se de abefi
me ra ho cancer na ekum ma dodo me ra ho obo ha se na ne man kete na wawu agya wo me ra ho brother Joshua
Maju with the support no
okay
support I think said the
me support no o kakra fa like me pese you just connect it like you men how you can support us and also what the government can also do to support women.
Okay, with the support, remember the part of the men the part answer. It's we man said the next sister kids can now they're going to receive their breast cancer. I think the first thing I want to say
for the sake of our doctor, can you mingle the tree with
the English? Oh, sure.
Yes.
So if your wife is diagnosed with breast cancer, I think the first thing that you have to focus on is reassurance.
Okay.
Yes, psychological care. Because the person I have diagnosed with breast cancer is even dying
that
already.
Is one day we even go out and then
And
start
picking
doing
another woman.
Other stuff.
Sure.
I don't want to mention any other woman, but they will go out and do other stuff, and then they will neglect the woman in their house.
Sure.
Forgetting that they are the person that caused it, because most men causes this disease.
What do you mean?
What I mean is most men, because of the way they touch the breast, it can even bring some kind of sore in the breast.
I wouldn't say how the men handle the breast.
Why are you trying to support them?
Oh no, because if you look at it from a medical standpoint, I mean the worst you can do if a man malhandles a woman's breast is cause some sort of trauma. But a traumatic breast, like maybe traumatic fat necrosis of the breast, is totally different from breast cancer.
Really?
Yes. As for the breast cancer, it's not really how they touch it. I'm not saying they should malhandle their partners or their wives and all that. But
because I've met some guys, in fact,
no, but I mean, as for the risk factors which I mentioned earlier, I mean, we don't have any data yet as to connecting how the breast is handled with the cancer. Usually, for the most part, it's genetic most of the time.
Okay.
So yeah, that's
the government,
with the government in the part, that's for my own thinking. I think they need a support when it comes to the treatment. Yes, because the patient has been diagnosed already. Into when the government, the way to with the cost involved in the treatment, like in the surgery and the chemo, some of the drugs are very expensive. And so there should be a reduction. Not almost when purchasing the drugs or even the treatment plans, say surgery, the cost involved in the particular surgery, so there should be a reduction. And then with MAAME partner, I want to still go there. Because sometimes we want if the wife is diagnosed, like it's something that should be taken into consideration. Because if the wife is diagnosed with that breast cancer, not or think of how I be a sex and as a sexual relating. Yes, but there are other options. Yes, even with the breast cancer, after treatment, if the person undergoes surgery or whatever, there can be prosthesis.
Oh, okay.
Yes, a bit much artificial.
Nana, one thing about a man even with or without breast cancer, they have something called, I've forgotten the name, but they use it on the breast so that breast augmentation and other stuff.
Okay.
Yes, so you can have that, not replace the lost one, and though it wouldn't be like the original one.
A woman you share you're advocating for breast cancer. Say something like this. And then what can we do about it? Like when a man and a wife I be saying
with when I think the breast no tuning in you're taking off.
Yeah.
Yes. Wait, we know.
Meaning it can spread from one breast to the other.
Both breasts could be involved.
Oh,
But
okay.
some women, after the breast is taken out, they prefer to stay that way. They don't want any artificials. But then this is where the plastic surgeon can come in, where they can give you the artificial, like, do surgery on this guy. It will look like you have a breast, but it's all artificial. But some people, when they take it off, they rather stay that way. So it depends on the person involved. Yes.
So at this stage, if you are a man, you have to stay close to your woman. They will run away. I know
So
these people.
Yeah, they would have to be supportive. I mean,
That
take
is
it,
it.
be supportive of the wife.
We are man as I say. I think say we nipa ojun nipa ho sounds why you have to stay with the person because say not the person wasn't like this.
Some people don't share their sentiments. No, what you are feeling isn't what they are even thinking of.
That's true.
Yeah, because your sentiment can never be somebody else's sentiment. You understand? So seriously.
Yeah.
So I think with this
Education.
Yeah.
The more we educate the public, the men and the women as well, because I mean the support even goes both ways. You could be a woman and your husband is diagnosed with breast cancer. You have to be supportive of him as well.
But I don't usually hear about men having breast cancer.
Just last 2 weeks, we had a male patient that was diagnosed with breast cancer. It's uncommon, but it happens. So it's the myth that usually many people think that it's just for the women. I want to say that the men too should be out there looking out for it. If you see any changes in your breast, sister talked about the nipple going inside. For this particular man, that's how he presented. The nipple had gone inside. So if you're a man and you notice any changes in the breast, any swelling, any reddening, don't take it for granted and be like, oh, I cannot be affected. It could be you as well. So kindly go to the hospital and be checked as well for the disease.
Doctor say, we a bema, and mamma, when your mother say, young man, one breast cancer. Bema to be to me, into your bema, now who's our nepo near Rema, and your wife say, Bia, oh, we move ye do, and I may come and tin, I'm enough for near common, also no for no ye pay. When nepo name him coma started so opaque, opaque diagnose. Yes, early detection saves lives, and yes, slow. Young person will be or banner bema. A woman say a man 90% of a man in ya, not 10% of men so 80 million, but with our child. But Modiana could diagnose it. We are both the rules, say, yeah, was when your breast cancer. And if I may try and one by me bar, dear old neighbor Sunday to us so amount.
COVID-19 by Tutuana, they were more considered. As so, what we saw on the India, every more survivor, and maybe Monsu. Ansem with away, and we hear me pa me perseminia new year. Oh, sorry, I wear exercise. Why I can say abroso? Dear bad, dear Crana would tell you. Now, what did you real cry? What time a bread bank and son of one so? Sansem with away, na, and some beside a who hear you pa. Obin so health issues are 110 or pa new year. And until a mammy Joe, Mrs. Shiame, I was Stream House TV so. Me mend away, and me mend the bia, a bra abo non do. I don't call but do backo. That is 10 to 11. Shiame, na mini and nim the 4 doctor for a mark quadare, I will nim dear. I will upon them, near pensing, Yama will health issue be our bia and new year. You might dear friend a health palace. Health palace, while pomu de here.
Or for me more quabo, made our sister when your time. Now, uncle baby, and our show program way. A very educative program, and I shut up professionals. I bet Nahanum say. Program I will share your friend a health palace. Health palace, a woman say what pomodino. The basis is 2 years. I won't fire Arabia and found a woman. I require not when in na so and I say ignorant nti na create awareness e wa ha say no media ne mama jo koso ana he program we ye to aso nti de wo bia bia wa asem bia ye nya antan ye no me ma ne ha ye be koso ana ya ye den ye discuss uwie na sa won ti ase a comment section ho ko ha who subscribe to Stream House TV now call comment section where comment be our person make it on this program no there fabra ye be ma answer no kama pa afi your doctors no so ho time bia wo hia o my dem numbers be ma midwives no so ha say sister Petra so womba but boy chidom ye da na se pa nti yan ko ma me ko busa me doctors no last questions e hu hia ka se pa ye wia ye be ko so ana ye den you know I interact a comment section with the officer will be say with me about say doctor.
Yes, please.
Another be mama anti-Kate. A dear bad dear now feel say obi a cancer and when you know. And that's what is there a hope for someone who has cancer? Yeah, boom, mammy.
You can't say early detection. A boy meet me say, be our breast cancer. It's message say, cancer, bet me a boa, asa, amanaqua, in a stage I would be ban. It's message, tell me and can say, oh, a drea, a catch the word, you and you who have a 2 centi, who cry not what's nephew. Because you see, options be real, or treatment options be real, yeah, meaning Abu Bobos. The message say, you won't go for me, bra, or many be our more survivors or motias.
Sell the idea
if you hope for more 40 as it's messy. See who and I say a catch the yarn. A bit full of treatment options at Damayan. Now, boy, and let me, I may answer at Natanasi Ebi. General so ever.
That's pa. Uncle Joshua.
You.
A devil and then officer, any that's all. Will be our nyaya really be. Is there hope for that person?
There is a hope, and that's what the hope. In fact, my media example. Nti se uhwe ni pebi tse ya na ni kura sa age kura ka ho ni da so the bull
advocate
though in personal life there will be some form of impaired body image but no shouldn't put you at depression say we should be depressed with it. Though sometimes you feel sorry say be a breast no in your honey but I think say you are still alive. I think the only thing is we should look out for say you be alive and not say alive. If you are alive, there is still hope. Until I think say you trim your car, you say, "You need to come to a bar," and I say, since your heart is still working and your brains are still intact, I think there is still hope for you to do everything you wish to do in life."
Wow, thanks a lot, Doctor. Is there a hope for someone who has
gotten
or who has gotten to the second stage?
Yeah, there is hope. Always there is hope because. Once you are detected or diagnosed of breast cancer and you start the treatment, I mean, we have cases where you have full remission, the person recovers completely. So,
really?
Yes, the population should be encouraged. So, as soon as you are diagnosed, it doesn't mean it's all over for you. In fact, with the management of cancer, it's a multidisciplinary team. So, you have the oncologist who is a cancer specialist, you could have the general surgeon, could have the psychologists, people that would encourage you if you're getting depressed to like keep you on track. Because when you start the journey and you are lost to follow up, then it's difficult to monitor how well you are doing on the treatment. So if you are diagnosed, the message to the public is please stay on course, complete. I mean, sometimes with the cost can be expensive, so you need the support of family.
It's because
and
of
friends.
the expenses that is why people are running away from the doctors.
So most of the time,
let me ask you, doctors, anytime before, anytime we come for treatment, all we do is cash down before we. I've heard a lot about it, cash and carry system and all that.
Typically speaking, like in a government hospital or a quasi-government hospital like Tech, the doctors, we don't even get in touch with the money. You pay at the banking section and all that. So most of these prices is not as for the.
You should discuss it with your management.
And yes, as you rightly said, the government has to come into play when it comes to the cost of these medications, because it's not the doctor who decides how much this will cost or that. You are there to do the work and then the patient pays for it. The money doesn't even come to you directly. So in certain developed countries, these medications are even taken care of by insurance completely. so that you don't have to bear the cost of all this, and then the patients complete the treatment. Most of the time in Africa or in the less developed world, our patients are lost to follow up because they can't afford, and that's why when they return to the hospital, it's like it's already bad and then they die. But otherwise, when you are detected early and you stay on course with the treatment, the prognosis usually can be good. So the message is to the government as well to try and see how this
look into your camera and tell
how
the
this
government.
cost can be subsidized, so that if a person is diagnosed of cancer, I mean, they can be able to afford and go through with the treatment completely. So that, I mean, the outcome is better for them.
So do we have doctors who see to that? I mean, who see to the therapies and all other stuff?
Yes,
Because
we do.
mostly all I hear is this person is sick, or this person is having this kind of disease, and they've taken him to South Africa.
Oh, we do. In Ghana here, we do. We have oncologists, because those are the people that
Are you
will
a
take it.
Ghanaian?
I'm not a Ghanaian, but I studied here and I'm working here.
Oh, really?
Yes.
From which country?
I'm from Cameroon.
Cameroon. Ghana for Cameroon new. Dr.
Vivan.
Vivan rather.
Yes,
Dr. Vivan Fett, our news hospital, and our advice from Cameroon. Ghana doctors, and then I'm more Ghana doctors, and then I'm more to advocate this disease. I hear come once who be no we are back hospital, not doctors and nurses, no more treating ya because but have you also forgotten say we are there for each other? It's a say it me bomb and support because I are really or benya bia Asia into doctors here pamucho Ghana doctors. Yes, somewhere they Ghanaians, but Cameroon for support there. And then I say globally no we are one. And Miss Remo, young mama dear say you best support so young. Ye boa Ghana for doctors, ya want money my name so intimate kayasam and Remo. Young, go ahead.
Yeah, I was saying.
So if you have a shout out, you can just you know.
Oh, I mean, a shout out to all my colleague doctors who,
Especially
day in, day out, and working to help patients and make them better. I want to encourage them to keep doing the good work.
Especially who?
No particular special person.
Are you sure?
Yes. Yes.
Are you sure? Uncle Joshua.
Like the person can be about the breast cancer. You see, there are some.
We have found when chat to us.
Automatically. There are some clients, if the patient who say was some signs, most of them depends on the herbal medicines more.
It says to say, doctor, you know, just a naturopath, no. They say all they do is we have cure for cancer. We have cure for cancer. So when they have this kind of cancer, or if they feel like there's a lump, maybe I won't go to the hospital. No. All because they fear that they will be treated anyhow.
Really?
Yes, that I've heard a lot. Sometimes the people will say, I won't go for a nurse to treat me anyhow. So when you are having your meetings, you also talk to the nurses, because sometimes the fear of being maltreated or being talked to anyhow, because some people doesn't want to be looked down on. So when they are looked down on, then the next day they wouldn't want to come to the hospital. You understand?
Yeah, I think on our part too, as medical professionals, we have to be professional with the job.
That is it.
But patients too should not be discouraged, because at the end of the day, it's your life, it's your health. You'll be surprised at how much patients spend with herbal medication. It's not that cheap. Yeah.
Because they are the people that goes on radio and other
they spend
medium
a lot.
to.
Sometimes
They do adverts, a lot of
Yes.
adverts. Yes.
and it's not cheap. As contrary to the belief, people think herbal medication is always cheaper. Sometimes they come to the hospital and their money is finished because they spent everything on herbal preparations and all that didn't work for them.
Because they fear that the other doctors would do what I don't know.
Well,
Some of them, they think that the hospital is much costly.
but
Yes.
at the end of the day,
So by the time the person gets to the hospital, then who's the answer? So at the end of the day, the person has nothing to, pay the hospital bill.
Now one funny thing is they will even go to the prophets. For them to be touched and then be delivered. I don't know if cancer too can be. Hey.
This is a spiritual issue.
know,
With the spiritual issue and the physical issue, I think God knows everything, and
We
God
need
can do it.
to hammer there, because it's like
Sure.
Most women are ignorant.
That's
So they
true.
even if they are having a slight headache, they think it's spiritual.
You see, and that's a myth that has to be debunked because not everything is spiritual. I mean, God is the author of science. So in as much as you are praying, you have to do the right thing. If you are praying for God to heal you and you know you're supposed to take this medication and you deliberately don't take it, I mean, you are not being, it's like you're testing God or something. Yeah, I mean, a show of your faith is how you also act.
As of for now, what prayer comes now. Moji grow photo on your papucho. Any panabana no phone, no phone, ye near brepa. Obana send no phone, be able to mammy pacho when you pie wasem. That is why Yankopon ma adopted him dear. So on fine day, on fine no yaw dear. Spiritual aspects no dear. Fatu in Chobon Pieman, you are in to hop. Manem cop. Emma ni mewu, Emma no for me say, Emma ni that so and say yes, and it does so or pant, who's any panaba. Be it diabetes, pressure, ya be a wubon pieman you have a patcho. Ya can is over hospital. And can you go on my doctor named dear da. Yes, Ramo. Auntie Kate. So what do one who see one?
And I think said
One who see on Chawbia.
So me chill be your habia.
Oh, Jack, man, chef.
Me share hospital.
Son out here.
Me chill be your habia, me hospital for me chill be a me busi on phone in a very much for me. What you say?
And I
Manusi.
Don't you have a special someone there?
No, me need special.
Are you sure?
I don't have any special.
Hey, Monyo doctor, nurse, Monyo. Okay. Auntie Kate. But I will ask for you that I know you have a special someone.
Yes. So bibi kakra me sa aka won say Dr. Maye who says so breastfeed till risk ne so. It means Ghana for ma say India na akosuri nti ye free say
ma aduane.
Yes. Ye breastfeed no fun beti agu ni adan nti o breastfeed kra.
No. Why?
And a man su.
But it
doesn't have any basis. Say Dr. Bonomas so am body nyanka ho. Say breastfeeding them.
It's like they are doing it for men.
Yes.
That said breast and they don't want the breast to sag. You don't want it to sag, but God has given you a baby. Now I say breastfeed the baby. I say I'll give the person and I say I'll give the baby konkomediane. Hey, serious oh.
It's the best say man. Yan breastfeed the
man. No so cry one funny thing is Tebama no. When me na wa we no kran still on recognizing no for ni biemu. On fanya hwe. I just said na corner sorry and son wa person obenom no phone. No phone na wanom say. Na uba na to aso why.
Yes, say. Ye wo a be hwe so ma ye man no phone. Ye can say when to me cry 2 years na betimi so 5 years. O breastfeed uba e tie exposure no so. E ma wunya breast cancer. Me mesre. E be koso ani e breastfeed ye man. Ye bia me hu ne say nim dia akoso ni life aye bonti. Ye nuanum me ni bo mo so mo no fu susu a. Nti obako hospitals baby akoni mpane ni no normal be
silicone.
Mesre no nso e ma race no ekosro. Nti e besre de nya media ma ono mo oni aso na me ma no so me se me ma no unnecessary pressure na no fu sa nti bia say SMA we follow the trend of emema ndo mo pe. Nti mesre se de won na ehwe so ye ni akofra mpane bi wo ho na me exposure na nye kese no bi nya breast cancer. Ti e be hwe sa de ne so ye. E be fa kwanye su a che mi ra Franka Kuto ene me ba ku me free akoto abim ko free akoto ni me phone na me na
hospital ni yo ya me to camera ni me yanti
Franka Kuto mi kunu no
o ka bibi o dey kan use word we so obrim pon anase
obrim pon free akoto
kan ni ye ma ne nkọ na koma
na nkunim free akoto afi me na hospital administrator CEO doctors ni nurses midwives ni na you made from Fatih Ibrahim me chia pa me da mu nyina mas.
Na wadam funa to man wadam funa slow camera no
Madam Petra me chia pa me dine se me me so be ka me ha me aba be ejumedi da mu nyina ase
Joshua say we need special someone here yeah. Oh madam was say someone adaje share program in fact program na I very interesting and I was a pa kosua na share health palace because you want bebre ya started say we will be discussing a lot and na professionals in next week promising to be a wonderful one nti yesra pomodian na subscribe na share my like na comment and don't men shekeke comment my Because so when you subscribe to Streamhouse TV, yeah, sign a soft for yeah, Ankasano. Yeah, naturally, no. And Pie Bonnie had the decide the change to her. Now want to abandon and tongue because one of program. So being breast cancer and just any that's what sound. There is hope. Last time, I mean, share, you say, pink, no, HSA, and that's so. Our home will be when you be. And I think so masses of people and then yes I really and inti ye think ne advocate man to when you yes ye cancer breast cancer cancers na dawson na mom de kuma market se pa breast cancer if you want ma lung cancer cancers na dawson e kuma nipa bebre nti mesraw wo de free ne it's now a Sunday Monday go and check it wo de doctor wana ko hwe say also bet me anya cancer e bia na se mpo lamp ya ye kan e bia beto unufumu a se be ya unkowo mpo fremonti mesro de mesre wa na se koso ana ye den e ko check up ma ye because ye create awareness yan person obia bewu out of breast cancer nti ma wani mre because unkwa ho hia we your bad time na se we ja o ma ho because of breast cancer e be ya reho meant na home masaya really enku meda obi bia o share program yes especially a brochure farm supportive program we asumi Sonia just see because me bobodi na modo so do kwa me adomakon Chris Lord ne Hakim kese a brochure farm because mo nya se Ghana for mo support you na mo brochure farm no mo share program no ma ye kese pa afa ye crew na mabre papa entire program na ntimi afa ye crew ye da obi bia so for ma Justin efiakobi ne ima in fact ima for the doson ima Justin ne obi bia o support ye bia Gideon ye late nti on dem mfi no afa ye Dr. Sam so ba be ye den obebo ye chidom Sister Petra so ebe boy ye chidom ye do bibia se ye da nooks for so ase nooks hospital for ase somebody doctor fet edom yen afi manhia for ye da maso so somebody Dr. Joshua emaye and afi so hospital ne de eniwa hospital so ye da mase so Sister Petra ye da wase so de ne ba enemu wa mekasa ye da mase pa in fact obi bia o ma show we ye kama enne no de aseda sonko e de ma mi din aye MAAME Jo ana se Josephine Aboaje menu mi ankasa meje me ho me na se authentic one nti wo hia me na authentic one a so meje wo so no size because mini size e o baby a e do bibia se nyame ya adoma na da se ne e be sign the health palace about one so aseda nka
Papa, COVID-19 by Toto na de wo makonsiedo aso wabusa wo ho de ntia ebi mu survive ye na bi mu nso awu ansem buta we ehu hia me pa me pese me nya anu yie wo sorry a wo ye exercise wa ye kese abroso de ba de kra na wo tai bi na wo didi wie kra wo tan ebre ben ansa na wanom suo sansem busa we nyina ye nsem busa ehu hia ye pa obi nso wo health issues a hana denden a opa no yie enu nti na MAAME Jo me se hia me e wo Streamhouse TV so me menda we ene me menda bia ebra abonondu adokobo du baako that is 10 to 11 chia me na me ne animdefo doctor fo oma kwadare e wo nimdie ho e wo apomuden ho ne pensen ye ma wo health issue bi a wo bia e ho ano yie duma de ye fa na health palace wa pomuden ho hiaye